Well, good morning. I am Dr. Olivier Benaroche from France, dental surgeon and hypnotherapist and director of Obi-Wan Training Institute. I'm very pleased and honored to have been invited to this special event. I would like to thank all the organization, especially the president of the National Research Oncology Center in Kazakhstan, Dr. Gulnava Kulayeva, Didar Diosetov, Yerlan Ombejanov, and for help, Alexandra Mans. I will address the subject of pain management with hypnosis in palliative care in an integrative approach. After a short introduction, we'll see together the specificity of supportive or palliative care, and we'll see the benefits of using medical hypnosis in that context. We'll share some definitions about hypnosis and pain, going with neurosciences claims. And it will lead us to spot some hypnotic methods and strategy, and then to a general conclusion. As we all know, cancer and its treatments have many side effects. These symptoms negatively impact the quality of life of patients, and we can consider medical hypnosis as a complementary approach from an integrative perspective that can provide help both to patients and their entourage, and to caregivers. Many studies have shown the effectiveness of hypnosis for reducing pain, for managing the discomfort of side effects, to improve living condition and well-being of patients, and if needed, promoting an end-of-life support. We will see different hypnotic methods make it possible to adapt to the singularity of each situation. In this short presentation, we will see the relevance of hypnosis as a complement to conventional medical treatments in the face of a whole series of challenges by setting new quality life goals to patients. So what are the specificity of supportive care in oncology? If we see them from a patient's perspective, there are a lot of needs that have to be reached. Physical needs, which are more important is maybe the pain, but also emotional needs, social needs, existential needs, which all lead to a unique individual experience of hopelessness and helplessness. From that, we can see that it's absolutely needed to take all these needs into account for the patient and his entourage. In a perspective of the caregivers, we have all been confronted to technological limits, to the accumulation of stress, fatigue, and negative empathy that can impact our psychological balance with the risk of burnout. We have all encountered in emergency or chronic situation relationship difficulties leading to emotional blockages. So there is also a need for training of the practitioner to preserve his own balance. To use hypnosis in the context of palliative care is to make the proposal to the patient to live his situation differently, to appropriate it in a different way, but undoubtedly also in a more human way by calling on his own resources. This invitation thus can be deployed beyond symptomatic relief as also an existential aim. We can use the techniques of hypnosis to create a better therapeutic alliance, which will take in account the patient's unicity and defenses mechanisms. We can specifically use the tools of conversational hypnosis for the creation and the maintaining of a good therapeutic alliance. We will be able to make a bond that will allow the things to go further. It can be useful also as an help in announcing the diagnosis, which can be a real trauma, and some people can be very stuck, which pose a problem of lack of integration of informations. So hypnotic communication makes it possible to take the patient out of his amazement, to reframe the disease as an opportunity to use his resources and to establish new priorities in order to be able to better appreciate this end-of-life period. Of course, medical hypnosis is used for the management of anxiety and pain. It can be procedural intervention like biopsy, lumbar puncture, or surgery, post-operative or chronic pain. Hypnoanalgesia and hypnosedation provide better pain control by modifying the emotional dimension and the intensity of the painful sensation. It is useful to consider hypnosis also as a tool to manage the side effects of treatments. With hypnotherapy, we can manage physiological and psychological symptoms and have some relief about them. And with teaching self-hypnosis to patients, we can reinforce them to use this special learning in an autonomic way. The tools of hypnosis, and especially with self-hypnosis, we can learn to the patient to use coping strategy to face their new challenges and being able to express and share their emotion to live it in a more serene way. Let's now move to the definition. For many years, we have an international definition that makes authority, which defined hypnosis as a special state of consciousness in which there is an absorption of attention, a decrease in consciousness, and a greater ability to respond to suggestion. It is, above all, a question of a modified state of consciousness, which we can call it trance, but also a technique of special communication of particular relational mode, which, by a process of influence, open the way towards the psychic resource of the patients by circumventing the classic resistance to change. The communication techniques specific to hypnosis have the particularity of bypassing the intellectual sphere and allowing the patient to appropriate what he needs to the process of induction, which permit to go to this modified state of consciousness, and the use of suggestion, which can be anecdotes, paradox, direct or indirect communications. The hypnotherapy suggests to the patient changes in his automatisms, sensation, perceptions, thoughts, or behaviors. Neuroimaging techniques highlight cerebral processes specific to the state of hypnosis. There is indeed a specific and observable modified state of consciousness different from sleep and wakefulness. 3 specific cortical networks are involved in hypnosis, and the objectival functional modification observed at that level are correlated with the subjective experience of hypnotized patients, which are modification of self-awareness, detachments and dissociation, increase in suggestibility, or hallucination, for example. I propose to illustrate these theoretical elements with a concrete clinical example. We are going to see the different stages of a treatment under hypnosis. That means first the induction, then the suggestion of hypnotic analgesia, then the treatment phase. In the first sequence, you will see a simple example with a direct and rapid induction, which uses techniques of confusion by saturation and surprise in order to circumvent the critical factor and to trigger the modified state of consciousness.
Une deuxième fois. Voilà, complètement à l'intérieur. Et déjà, la respiration s'approfondit. Très bien. Voilà, ouvrez les yeux. Et la troisième fois. Et vous fermez les yeux. Vous allez complètement vers l'intérieur. C'est très très bien. Parfaitement relaxé, détendu.
In the second sequence, I first use a technique of reification by guiding the patient to imagine that she puts on a protective glove on her hand, positioned in a cataleptic way. Then I suggest, by means of an automatic movement, this modified hand would transfer the analgesia to the level of the operating zone.
Vous imaginez simplement qu'il y a un gant de protection anesthésique qui vient recouvrir cette main-là. Vous pouvez imaginer la couleur, voilà, l'épaisseur, la matière de ce gant. Et dès que vous avez imaginé ce gant qui vient protéger, anesthésier cette main, alors vous commencez à sentir comme une force magnétique qui vient attirer cette main de plus en plus vers le visage. Voilà, très très bien, à votre rythme. Vous n'allez pas aller en hypnose profonde avant que cette main vienne toucher le visage pour y transférer la protection. Très très bien, à votre rythme, c'est parfait. Automatiquement, d'elle-même, parfait. Quand elle touche, les yeux se ferment. Voilà, et l'anesthésie vient se mettre sur toute la partie gauche de la mâchoire, diffusée au niveau de la joue, de la lèvre, de la muqueuse, de la dent, de la gencive, des ligaments, de l'os. Toute cette protection se met en place.
Finally, during the care phase, the brain not making the difference between reality and fiction I use a dissociation technique to distract the patient's attention from the here and now and keep her comfortable on an imaginary beach. This makes it possible to perform the dental extraction treatment in complete peace of mind without even the use of a chemical anesthesia.
Voilà, très très bien. Avec ce sentiment de vacances, de bien-être, au fur et à mesure que vous vous promenez. Je ne sais pas si vous décidez vraiment de vous baigner, de sentir que l'eau arrive progressivement, de plus en plus confortablement, à hauteur des genoux, à hauteur des jambes. Très très bien. Et peut-être que vous aimez nager ou simplement marcher dans l'eau.
As to go on with definition, we'll go to the basics with the international definition of pain, which is an unpleasant sensory and emotional experience associated with actual or potential tissue damage or described in terms suggestive of such damage. What we can spot in this definition that there are two phases of this multidimensional experience, which is called pain. We can say that it's one thing to have pain at a sensory level, which talks about qualitative and quantitative characteristics, and to be in pain, which involves affective or emotional components, cognitive components, which are what we think about what we are experiencing, or a behavioral component, the way we act about it. And so relieving pain means addressing it both in its objective manifestation at the bodily level, of course, but also in its subjective consequences within the patient's whole existence. That the pain message is not retained in a simple area in the brain, but it is encoded in a vast and complex brain network, making it the matrix of pain. And today we know that each component of pain is encoded at the level of a specific brain area. Sensory discriminative component and emotional components and cognitive or behavioral components are treated by very specific brain areas, and the whole treatment will give us the entire experience of pain. In a landmark study, Pierre Rainville of the University of Montreal demonstrated that hypnotic suggestion acts specifically by modulating the activity of brain areas involved in the overall experience of pain. That's an amazing discovery, that we can understand that with hypnotic suggestion, we can act on every component of pain. We'll be able to specifically suggest some relief at different levels to be more effective. Therefore, we can spot some different hypnotic method and strategy to overcome pain and discomfort for any patient. First of all, we already talked about it, the creation of a very strong therapeutic alliance thanks to conversational hypnosis. It allows us to establish a very strong bond and personalized trust. We can respect the patient defense mechanism and help him mostly when the verbalization are very difficult. We can use tools also to improve the confidence and self-esteem as ratifying and encouraging the patient's past experience and to restore him the first role and the capacity of succeed in some way. He can therefore experience again the experience of success and make it alive. There are many techniques using the particular use of dissociation, which allows to teaching the patient to take refuge either in an imaginary safe place or pleasant memory, which leads his attention to everything else but the pain. It will also help him to learn to cut his sensory afferences or to modify his perception of reality and to create new beneficial associations. With the technique of reification of modeling, we make use of imagination to analogically modify the perception and physiology. Maybe you have heard that we can teach patients to imagine imaginary glove on their hand and to feel that all sensory has disappeared, and then to transfer this learning to any part of his body is needed. With techniques of reframing and metaphors, we can help the patient to make a change of perspectives and establishing different priorities and getting it out of his focusing of his unique symptom, and it can help to better manage stress and associated symptoms. In the same idea, a symbolic exploration of the problem stimulates unconscious coping resources. Another way to use hypnosis is to teach the patient self-hypnosis. In this way, he can maintain an active role in an automated way and promoting a feeling of control and more comfortable emotional experience. And we can say that combating pain has become, in the light of knowledge, a technical necessity and an ethical obligation, thanks to the quality of the therapeutic relationship in the overall care of the patient. It is now well established that the integration of hypnosis in the care of cancer patients is beneficial both psychologically and physically. Of course, in the special context of supportive or palliative care, hypnosis can help the patient to find alternatives to the simple fact of being treated and waiting for death. He gains a sense of control, better self-esteem, a reduction of anxiety and pain, and of side effects. Hypnosis is a relation process in which the subject can get back into motion instead of remaining frozen on his symptom. He thus accesses a space of freedom of thought and action, which can be also beneficial with the people around to better cope with separation and mourning. It is therefore particularly interesting to reflect on the best way to implement these hypnosis techniques within oncology departments, which not only to improve the quality of life of patients, but also of caregivers. Well, thank you very much for your attention. I was very enthusiastic to share all about this subject, and I will be very pleased if you want to ask me any question. You can find my email address and the site of my training institute, and I wish you a good day. Thank you.